Good evening, my name is Julie Plummer, and today I'm going to be talking about concussion diagnostics. To give you a preview of what my slideshow will entail, I'll tell you that we're going to be discussing the definitions of what a concussion is, the importance of testing for them, the types of assessment, which can be both good and bad, and then I'm going to give examples of two different types of diagnostic tests, one being the impact test, the other being the SCAT-3 exam. So what is a concussion? The formal definition of a concussion is a type of brain injury characterized by immediate and transient alteration in brain function, including alteration of mental status and level of consciousness resulting from mechanical force or trauma. And that was from the American Association of Neurological Surgeons. So a concussion is a type of brain injury. It's an invisible injury, but it has real consequences. It includes the rapid deceleration of brain tissue within the skull. This causes the tissue to change shape and therefore not function like it used to efficiently. In the United States, currently there are 1.8 to 3.6 billion sports-related concussions per year. And there is no such thing as a minor concussion. Each is unique, each is serious, and each needs to be diagnosed. So you may be asking, well, how do I know when to diagnose? And that's a very good question, because like I said, not all concussions look the same, therefore can be diagnosed or treated to be diagnosed. So how to identify when to assess? Typical first responders are paramedics and athletic trainers. But doesn't look like a broken bone. You can't see a limb hanging there or any snap. A concussion is completely internal. And a fact to note is loss of consciousness occurs in only less than 10% of concussions. And that's the most obvious warning sign that people usually think of when they think of concussions, but that is not always the case. In fact, it's not usually the case. So, what are some obvious initial warning signs? Those could be things like vomiting, visible imbalance in walking. It could be retrograde amnesia, which is forgetting the event before the incident. There could be irritable behavior, such as denial of an injury. The patient could have a sleep-like vacant look on their face. They could have a slur in their speech or confusion. And it's good to know that this looks different in every concussion. So it's better to assess than assume. There's a problem with this, though. Not all concussions, A, happen in the presence of a first responder, B, are reported immediately, because many athletes tend to want to continue playing and don't report their symptoms in hopes of not sitting bench. But if they do this, this could lead to them being sidelined for longer. And third, not all concussions look the same. Many people don't see a doctor right after they're injured. Say it was a person who was in a car accident, then yes, they're probably going to go to the hospital. But if an elderly person fell and tripped, or an athlete maybe hit their head in practice, those things may not be reported. Simply the players or coaches or parents just don't recognize the signs of concussions. So, the importance of diagnostics is huge. It objectifies post-injury condition, it helps track the recovery so that an athlete can return to full function, and it prevents the cumulative effects. If they're immediately getting rehabilitation after their injury, then they're more likely to both faster and better get back to their previous condition. I did want to mention that there are some inappropriate forms of concussion assessment. Not all of them truly diagnose them properly. So some examples are the CT scan up in this corner, the MRI, and the EEG. The EEG is usually used for testing patients with epilepsy or other brain disorders. And what that does is it has these little, those are receptors on, like external receptors, and those measure the brain activity of a patient. And then the CT scan and the MRI, those just simply take slides and images of the structural changes in the brain, and a concussion does not normally cause structural changes in the brain unless it's a condition where it's a fractured skull or hematoma or one of those conditions. But a person who is concussed could completely pass the CT scan and the MRI without any abnormal review. So there are two types of neurocognitive testing for athletes. The two forms are the baseline test, which happens previous to starting their sport, and the second is a post-injury test, which happens once a concussion is suspected. And this would be when an athlete's coach or athletic trainer or EMT notices those visible warning signs that we discussed. The first I'd like to talk about is the IMPACT test. This is the Immediate Post-Concussion Assessment and Cognitive Test. It's a computerized neurocognitive tool, and it is only available through licensed healthcare providers, but it helps athletes to know how severe their concussion is and how to track a specific rehabilitation track. And currently, it's the only FDA-approved concussion evaluation and management tool. And many high school athletes, college athletes are all required to take this prior to beginning a varsity sport. Like I said, it's used by more than 7,400 high schools and 1,000 colleges. And here are some examples of the test. It tests memory, reaction time, and working memory. The second that I'd like to discuss is the SCAT-3, or the Sport Concussion Assessment Tool, 3rd edition. The SCAT is a standardized tool for evaluating injured athletes 13 and over for a concussion. And what it is unlike IMPACT, it's tested immediately after the injury, mostly done by an athletic trainer, typically in the sideline or a locker room. After taking this test, the athlete is not allowed to return to the sport that same day if they do not pass. So the SCAT procedure is made up of 4 parts. It has a standardized assessment, a balance assessment, a coordination exam, and a symptom assessment. So here's an example of the symptom evaluation that the athlete would get immediately after. They'd be asked a list of 22 possible symptoms, and they would fill out to what degree they feel those. For the cognitive and physical evaluation, those are things like testing balance, doing eye-to-nose coordination, walking in a straight line, ability to recite the months, some words, some numbers, different things like that. Also, there's a neck examination looking at range of motion. I already mentioned the balance exam, and then the coordination exam. So review, I just want to let you know that concussion diagnostics and assessment is super important to getting a person back to where they were previous to injury. So the goals here are to identify when a concussion happens, to examine it, even if we're not 100% sure if it's a concussion, we need to determine this through diagnostics. And then once we diagnose, we can make a plan to rehab that properly and get the person back to full recovery. And that could look like return to living, return to school, and finally return to play. So like I said before, it's better to assess than to assume. Thank you very much.